So this is our Bubblehe video. I applied my general principles and safety practices, performed hand hygiene, applied my clean gloves. So I'm going to just talk to my mom, establish a good rapport with her. I want to make sure she's bonding with baby or just mentally dealing with issues that may have arisen. Maybe it's a loss or adoption, whatever mom's going through. I want to make sure she has good support. I want to observe the interaction with the people in the room and make sure that she has support when she goes home, provide her with any resources she may require. I also want to make sure she's already emptied her bladder when I came into the room, and if she hasn't, I'll help her up and assist her in doing so before we start our assessment. I'm going to explain my assessment. So in the beginning, I'm going to go ahead and obtain a set of vital signs, and they were stable. I want to auscultate my lung and heart sounds. They were also good. I want to determine if my mom is going to breast or bottle feed, provide her education and support for whichever she chooses. I want to do a breast assessment. I'm just observing for symmetry, redness, pain, swelling. I want to ask her if she's in any pain. I'm going to palpate in a circular motion. I want to educate mom on what to expect and what's abnormal, when to notify the healthcare physician or the healthcare physician, and educate mom on proper breast support depending on if she's breast or bottle feeding. I'm going to move on down to our abdominal area. I'm just going to observe the abdomen. I'm going to palpate the fundus. I'm going to support the bottom of it at the top of the pubis, and I want to determine the height in relation to the umbilicus, the tone, and the definition of the uterus. If I do feel that it's boggy, I want to massage that uterus to get a more appropriate feeling of the tone and I guess consistency of the uterus. I'm not sure what to say. So anyway, mom feels good here. I'll also assess her for any pain and educate her on what to expect and signs of pain that she should report. I also want to auscultate for my bowel sounds, make sure she's passing gas, determine when her last bowel movement was. It's important that we keep mom from becoming constipated. I also want to assess my bladder. I'm looking for any distension or pain. I also want to educate mom on the importance of emptying the bladder, how to record and measure, and the frequency of our urinary output. Then I'm going to move down to our perineal area. I'm going to educate mom on lochia and any bleeding, what to expect, signs and symptoms that she needs to be sure to report. I'm going to determine how many pads mom's going through and the frequency and the amount of each pad. I'm then going to observe and taco my current sanitary napkin and dispose of it properly. I want to assess the perineal area for any tearing. I want to assess the episiotomy if there is one. I want to instruct mom on perineal care and how to use a peri bottle and just to pat dry. I'm going to rotate mom towards me, and I'm going to observe for any blood pooling on the Chuck's pad beneath her. I'm going to observe or taco the pad below and dispose of it properly and apply a clean one. And I'm also again going to observe the anal area for any hemorrhoids, the back of the episiotomy, any tearing, swelling. And mom is good. Then I'm going to apply a clean sanitary napkin. And she's comfortable there. Now I want to assess for any signs of a DVT, and I want to educate mom on signs and symptoms to look out for and when to report them. So I'm going to flex the knee this mannequin's hard to flex. So I'm gonna flex at the knee, and then I'm going to flex and extend the foot and assess for any pain in the calf. Mom doesn't have any pain. I wanna make sure I assess both lower extremities for the Holman sign and then any edema, pain that she may have. I want to make sure I check Mom's chart for the presence of our rubella titer, make sure it's in there, whether or not she needs to have the rubella vaccine before she leaves. I want to make sure I know whether or not she needs to obtain the Rogaine shot, and I want to make sure I check her H&H levels and make sure that those are okay and there are no signs of bleeding. I would dispose of my supplies and material. I would perform hand hygiene, make sure Mom's comfortable, answer any questions that she has, and record and record.